care of them. If you've had the flu, you realize that that's a situation where you need some help. And then some folks have severe symptoms. In fact, for the over 60 crowd, about 20%, and for the under 60 folks, about 10%. And then for the older folks, some pretty serious critical hospitalization, the double pneumonias and the ventilators. Next slide. This is just an example that shows you by those age groups how many folks end up in the hospital. Won't get into the details of all that, the per 100,000s, but you can see for the younger folks, lower. But if you start to look in the 40, 50, 65 year old groups where a portion of our workforce resides, you'll see that hospitalization increases. Next slide. So when you're dealing with an infectious disease, you'll use models to try to predict how many folks are going to get infected. To do that, Clemson has utilized public health expertise. We have internal, some of our own folks, also external, work closely with the Medical University of South Carolina, and collaborated with folks nationally to make sure that we're getting all of the current information and getting a robust amount of data and information and modeling for us to look at. Those folks are using established models for infectious disease that have been around for a good long time. But the challenge here is that COVID-19 is new. And so they don't know that much about the disease yet. They're still learning. Every day we learn something new. So when you're dealing with infectious disease and you're trying to model what's going to happen, you're looking to predict in the future, something like hurricane models, and you're dealing with human lives and human safety and students and employees, you're going to be more conservative. And that means that decision makers have to consider that at times they don't have all of the information because it's a brand new disease. Next slide. So when you're modeling, what are the key variables that they're going to look at? Well, two of the key variables when you're trying to predict what's Clemson University going to look like in a month, in 2 months. They look at the reproduction rate, and that's simply the expected number of cases that one infected person is going to generate. So if I have it, how many people am I likely to infect? That reproduction rate can be impacted by classroom layout, cleaning, wearing masks, hand washing, limiting social interactions. And so if folks do those types of things, they can reduce the spread of the infection. It's really important. They also look at what's the local case rate. So when you're doing those models, if there are a lot of virus in your region or not. And we know that in South Carolina, the community rate, that spread of infection has gone up dramatically. About 2/3 of our students are from South Carolina. Vast majority, almost 100% of our workforce is in South Carolina. So what's happening here gets to be important. Next slide. Now this is that case rate in our region, and you can see that we've had some significant increase. Back when we were doing our initial planning, May, June, that was a moderate to low case rate. Now we have seen in July, it's gotten large. So that's concerning, and that leads to the decisions that we've had to make. But there is some good news here, because if you look at other regions that have had this type of growth, New York in particular, once folks really get dedicated to that social distancing, taking those precautions, you'll see that the case rate actually will drop. And so there are regions of the country that have gone through this peak and things are better for them now. And we're optimistic that that's going to be what's happening here as well. Next slide. So when the modelers ran all the different models, where did they end up? Well, when they modeled the student body, on campus, in housing, the local folks that are living off campus, those models consistently showed a rapid increase in the number of students that were infected at one time. Large number of students with coronavirus. Those peaks were several thousand or more. We looked at what about just the freshmen? Bring the freshmen back into housing first, and would that be a nice way to start, and then bring upperclassmen back in a little bit later? The challenge that we ran into where the models showed that the on-campus groups and the off-campus groups would likely interact with each other. And we ended up with similar results as just modeling the entire student body. And so just bringing the freshmen back first turned out to have roughly the same results, large number of infected students at any given time. And if you recall from what you'll see on TV and the news on the internet, those graphs peak and then drop back down. But when you have at that peak a lot of infected folks, you have to figure out how are you going to care for them? What are you going to do? It's also important to know about these models. They predict the total number of infected people. The test data that you see out there are actual tests, and that's just a subset because some folks don't get tested. So when you're looking at the model predictions, it's a large number. When you see the results of who's actually tested, it's a smaller number. And you'll often see the public health officials say, these many folks tested positive, but we think these many folks in the total population are actually infected. It's normally a much larger number. The other important thing to know about models is they get better with more testing data. So the more data, the more real life data you can feed into them, then the better they're going to get. Next slide. So what are the impacts? Well, in the models that were run for us, our quarantine bed capacity was quickly exceeded in almost every model. And if you look at public health principles, if someone tests positive, if someone has the disease, the infection, the virus, then you're supposed to quarantine them. And if you run out of quarantine beds, then where do you end up? Do you quarantine a resident hall? Do you leave students in their rooms for a couple of weeks? Can they roam around their floor? Can they go home? How do they move about campus? And it starts to present some issues to take care of the students. So how would you care for them? How would you take care of their mental health? How would you provide health care? What would you do with dining? What would you do with the maintenance of the dorm? Need servicing and the cleaning, which is an important part of limiting the spread of the infection. So all those things have to be considered, even though the student population is better than the older population, where many of them don't have significant issues, although some do, and we have to consider that. But you have to consider the impacts on your workforce. Next slide. So this is a workforce demographics slide for Clemson, and you'll see that a healthy portion of our workers are 40 or older. Clemson's a place everybody loves. We like to come here, work here, and we don't leave that often. And so in the older group, 50 to 59 and 60 to 69, large portion of our workforce. The folks that are responsible for cleaning and disinfecting, 62% of them are over 50. And those are some of our frontline folks, along with the people that are helping in housing and in dining. Next slide. So when we looked at the workforce, we also noted that community rates were currently high. Hopeful they're going to drop, but they are going to be exposed to those students, many who would be asymptomatic, which means that the students may not have even gotten tested at this point. But some students can have more moderate symptoms. But our workforce is older, and older folks can have a more severe course of this illness. With respect to our faculty, which is really important, as well as the employees and staff, we have the ability to modulate that mix of in-person versus online, but for the staff that are right there inside housing and dining, it's very difficult. And if you take on the students into our housing, we're going to need to take care of them. And so our concerns about our ability to deliver those services increased over the past month. Next slide. So Provost Jones, I'm going to hand it back over to you. And Bob, you're still on mute.
This time I'm going to start talking about the process the institution used to come up to our plans for opening in fall semester and how we got to the decision that Clemson University announced this week. And it's the same process we're going to use to continue monitoring the situation and open up, we hope, in September for on-campus and blended learning. And it's a deep process, and it started in early June with our health advisors, who are internationally renowned, working with our faculty, our staff, and our administration carefully to build the processes behind mitigating our risk factors and aiming towards an opening on August 19th with blended learning, meaning that we would have in-class experiences as well as online class experiences, and in many courses those would be blended, and full occupancy of our residence halls. We were aiming for that, and we had worked hard to reach that goal. But all of us are aware that since mid-June, one of the important variables that affects infection rates that Chip went over is the community infection rate, and it was rising. And he showed in the models that we were going to end up, no matter what we seemed to do, with fairly extreme levels of quarantine, which would become logistically very, very difficult to deliver, and the infection rates would be very, very hard to control. And finally, it would lead to heightened risk for our employees and risks to our students and our employees. As Chip said right at the beginning of the talk, this is one of our guiding principles. We don't want those risks. We're trying to modify those. We're trying to create a safe and healthy environment. So we knew this wasn't going to work as originally planned. And so starting in early July, the same teams of people began working hard on bringing in other ideas and exploring options or what kind of fall semester we could have given the current situation. And we know that there are other things we can do to modify our success, as we've learned even just in the past month. One is to use different intensities and types of testing. We will be doing that. In fact, there's some very interesting processes and kinds of tests that you can use to get a better handle on what's going on and also help mitigate risk. We looked at different strategies for moving in the dorms. Chip talked about that, maybe bringing in freshmen early. We did thorough analysis of a lot of different options there. We thought about different kinds of delays in opening the university. And we've always had the option to modulate online versus in-person teaching. So by mid-July, we had pulled all of this together and weaved it into 4 macro level models. And next slide, please. And here they are. Number 1 was where we were headed when we started this process in early June, and that is to have that opening on August 19th with blended learning and full dormitories. All along, we had a polar opposite, and that was number 2. At any point in time, any of our courses can go fully online. We've planned for that. And so one of our options all along was to not open up the dorms and just have a fully online semester. We then started evaluating 2 intermediary strategies. One is a staggered return, bringing people into the dormitories a little at a time. Chip showed a little bit of the analysis on that and how in many ways we couldn't find a path to have low quarantine and make things work. And so finally, we looked at delaying in-person education and housing for a while, starting the campus online at first and then opening up later. And we see a path for that to work, and that became our recommendation. Next slide, please. Both the president and Chip and the chairman have mentioned that that decision now, and we've all learned it, is to start online August 19th, move into the dorms September 14th, and start blended learning on the 21st. There are a lot of advantages to this approach. Chip mentioned that when there are spikes in the United States, they're often followed by declines as people begin to tighten their mitigation strategies. Also, if we start at these dates, we're going to be able to provide 9 weeks or more of face-to-face learning. That's still a very meaningful experience for our students. Another advantage is that we can begin testing the students who are already in town and will be taking online classes even though there won't be in-person classes. So we can get an idea of what the population infection rates are and even if there's underlying potential for immunity. Those will help inform our models and give us better advantages to manage our health. And finally, there are a lot of other universities, hundreds, that are trying different approaches to opening and fall. All of them will be learning from each other, and we can learn best practices. And with all of these advantages, we feel that this is a good approach by delaying and starting in September. So to the next slide, please. I'm going to turn it over now to Tony, who will talk about some of the details of how we will start our fall semester.
Thank you, Bob. As Bob mentioned, we're gonna look at some of the details, logistics of testing and campus housing and a number of things now. So, Doug, if you would advance to the next slide, please. With respect to testing, the university is doing pre-arrival testing of all employees when they return to campus for work and all of our students. And we are using the PCR test, which is the gold standard of testing. Not the least expensive, not logistically the easiest, but certainly we think from a public health perspective, the best way to go. In addition to the pre-arrival testing, we will also be doing random testing of employees and students after everyone returns. So we should have a good baseline for knowing about the infection at the beginning of the semester and understanding what's going on with the disease as the semester unfolds. We've got a partnership with MUSC to perform the PCR testing. As many of you know, it began this week with testing on July 20th through 22nd, Monday through Wednesday of this week. And we tested nearly 2,000 people, primarily employees that have been working on campus during the pandemic or who are expected to return to campus in the fairly near future. One of the issues that is still being considered, as you know, we have a student population that comes from across the state and really across the nation. And so one of the things that we've begun to consider, it's not something that has been put in place yet, but the idea of doing serologic testing of students prior to the return to campus. From a public health perspective, we think this could be very advantageous in terms of, once again, understanding the disease, its prevalence, and having strategies to keep everyone healthy and safe. Next slide, please. With respect to student bills, we are scheduled to post the student bills next week, the week of July 27th. Due to financial aid requirements, the full amount of housing and dining will be reflected on the bill. That is very important because we do not want to have any disruption in financial aid. However, the bills will also reflect a credit towards those fees for the first month of the semester, which is approximately a 29% credit. Other campus fees, on-campus fees, will be credited proportionally as well. This is the same thing we did in the spring, and the primary fees with respect to those credits are campus recreation, often referred to as the FICE fee, transit fee, and the activity fee. With respect to parking fees are not being charged right now, and parking sign-up will happen once we begin bringing employees and students back to campus in earnest, and so those will be charged at a later date when it's appropriate. Next slide, please. With respect to housing and dining costs, as you know, earlier in the meeting, we approved housing and dining costs, and as with the tuition freeze, we are keeping those rates at a minimum. With respect to the 29% credit, that credit, it'll depend on the type of housing and the type of dining program, but it'll be somewhere in these ranges. So for housing, $586 to $1,680, and with dining, an average of about $590 credit for that 29% of the fall semester. Next slide, please. So the logistics of move-in, very complicated. Had a great plan in place to begin to bring people back by August 11th. Our housing staff has done a remarkable job. I'm very, very proud of the work that they've done since the beginning of COVID. But they are currently shifting gears and refining a new move-in plan. The plan's going to be dependent on schedules. There's going to need to be social distancing. And as always, we're going to work with our state, regional, and national health experts to make sure that we do this in the safest way possible. We're currently anticipating a 6-day process that will begin on September 13th and go through September 18th. Typically, move-in does not happen after classes begin. So the provost is working with his team to make sure that instructors are ready to offer maximum flexibility to students who, have to move in that week. And so, as you know, there will be asynchronous learning opportunities there. We will provide test flexibility, and just flexibility will be the key watchword to make sure that those students can move in and continue to do their coursework. We do anticipate a full plan will be provided by August 17th. Next slide, please. And Bob, I'm going to turn it back to you.
Thank you very much, Tony. As we get ready for this fall, now with our new plans, we realize that we have to make a few changes. And one of the most important changes that we have to deal with is helping our first-time students engage with and be successful as they start. This is a very challenging time for a student to arrive on a campus and to learn, how to engage in courses, where the dining halls are. There's a myriad of challenges that can make it difficult for a student to succeed. And we have normally a very, very substantial orientation and advising process and machinery to help them. And you know by Clemson University's success, our high retention rates, our high graduation rates, we're very good at that. But this is different. These students are not going to be on our campus. So we're starting a full court press to ramp up our existing orientation and advising, have high-tech, high-touch activities. We will be using podcasts and social media, emails, phone calls, and peer-to-peer reach-outs, students reaching out to freshmen, ongoing students to reach out to freshmen, give them advice, make friends, help them get engaged with the university and learn what they need to do to be successful. The other thing we did is when we started mapping out our courses that are going to be blended, that have a in-person component, we wanted every single freshman to be in at least one of those courses. And we have finished our course scheduling, and that is the case. Not a single freshman or first-time student will be without a face-to-face experience when we're able to get back to that in September. Our bridge students at Clemson are very, very important. They're just as important to us. In fact, we feel that they're Clemson students, even though they're also Tri-County Tech students for the first year. We're going to treat them in exactly the same way. They're going to have the same move-in dates because they live on dormitories on the Clemson campus. They will be closed, but we'll move them in the same time we move in the other students to our dormitories. They're going to have the same online switching to a blended learning start online at Tri-County Tech. And as soon as they arrive on our campus, Tri-County Tech has all their courses in blended mode, so they'll be able to get the face-to-face experiences that our freshmen, when they come back to the main campus, will get. And they too will be part of our full court press, more reach outs, more phone calls, more social media, get them engaged with Tri-County Tech and Clemson and let them know they're special and important because they are. Another thing that we did was make sure that we take care of our people. And a lot of folks are very, very concerned about this environment. Our students are excited about having in-classroom experiences, but some of them have trepidations and some have health risks. So we're making it very easy for them with a simple process to just go in and make an application and say, I really want to have only online learning. Any student can do that, and they don't need any supporting documentation. The benefit of having them sign in is then we can alert the faculty so that they know that some of their students will be all online and they can help with attendance and keeping track of them and helping them achieve their learning outcomes. The same thing goes for those who are doing the instruction. We happen to have, as employees, an official accommodation process for people who have health issues and other things, and it's sort of a human resources and legal process. That's an underlying thing we've always had and we still do. But for faculty who don't have situations where they would call for an accommodation like that, we are asking them to please engage with face-to-face learning. But in the conversations we have with them, if they have deep trepidations and deep concerns, we'll try to find a way to make it happen for the students and not have them have to come into their classroom and be face-to-face. This is a level of trust that we have in our faculty, and that the faculty have an expectation to trust the university and not have sort of forced teaching face-to-face. It's a best practice. It's important. It's a national dialogue right now. Many universities don't have good outcomes in their planning. Most of their courses, the vast majority of them, are purely online, even if they're opening up on their dormitories and bringing students back. At Clemson University, we have a much higher level of faculty engagement committed to our online versus our blended in-person teaching. In fact, 77% of all our courses are planned to have in-person teaching experience. Most other universities, 30%. I'm very proud of our faculty because of that commitment to our students. Next slide. And here are the numbers. We are planning an astounding 10,059 course sections. That's a lot of work, a lot of planning. And we have to have risk mitigation strategies for those courses, particularly when they're in person. And in the classroom, we'll have 6-foot spacing, and that reduces our capacity in the classrooms to only 1/3 of normal. That's a huge challenge. Face coverings are going to be required in the classroom, and instructors can choose to use a face shield under certain protocols. And this is important because in some classes, students need to be able to read the instructor's lips, particularly for language courses, for example. And we have cleaning protocols, and our faculty are amazing. They're great modelers. They have figured out ways for students who are coming and going into their classes for the in-person components to have 50% less intersections and running into and bumping into other students. That's really valuable because it's helping us de-densify the campus. This is not the training, this is not the kind of face-to-face and online blend of the past. It's not the traditional old-fashioned online learning where you just post things on the web, students go in and learn on their own and then take an online test. This is far different. This is blended learning. This is where we have face-to-face but virtual discussions, groups working together, interesting assignments that can be done online, and new technologies that can show live videos and bring that information straight into the classroom. It's highly interactive. It's deep. It's a great experience. It's far better than what we had typically done in years ago in typical online learning. So most of our instructors are not actually trained for that next level of the use of this technology. That means that over this summer, we've had to work hard to get our instructors ready for this higher level of learning. And so far, we're on course to have about 1,000 of them trained at the start of fall semester. Now, in terms of our off-campus locations and in terms of graduate education, all the teaching and learning processes and protocols that I just mentioned above will hold there as well. Next slide, please. I think we went backwards. Let's go forward. One more. Thank you. So our classrooms, turns out this had to be a heavy lift as well. We have 481 classrooms and labs that we'll be using for blended learning. 109 already were video capable, so we are ready to go on those 109. This summer, we had to rapidly upfit 238 of them with cameras and microphones and 28 laboratories as well. We got 106 to go. We think when fall starts, we're going to be right about there and have all of them ready. Now, I talked about that spacing and reduction in capacity in the classrooms. That means we had to find some other spaces, particularly for large enrollment courses, to be able to spread students out and get large numbers in. And now you're looking at the Swan Fitness Center. This is one of those classrooms that we're gearing up right now as we speak, so that our large enrollment classes can also have an in-person experience. Those are 6 by 6 spacings there, 1 student per desk. Now, other universities, almost all of them, in fact, have taken the large enrollment courses and put them fully online right off the top. Too hard to deal with. But we realized that freshmen in particular have a large number of courses of this type, and we did not want them to miss the face-to-face experience. So we went extra length and the extra cost of finding spaces like this and creating new large classrooms where we can teach face-to-face safely. Next slide. Students, when they arrive on campus, are going to have an app where they'll see their schedule of classes and their appointments for meals. And here's an example of a student. This is a 1-week mock-up of what a student will be able to look at in their calendar. The appointments that are in blue are classes that are fully online, so you'll see no classroom. They'll just know that at 8, for example, on Monday, their stat class at 12:20, they need to be at their computer because it's going to be live streamed. They'll be zooming in and interacting with people, but it starts at 12:20. They got to be ready. Go to Tuesday, and you can see there's another stats class that starts at 9:30. It's in green. That's a face-to-face. So on some of those courses and class times, they'll be actually in a room with other students and faculty. In those purple places that say breakfast and lunch, because we have to have social distancing and we have very carefully laid out protocols for health and safety in our dorms and in our dining halls, students can't come and mingle in large groups. They have to go and pick up their meals or go in spaces with very low density at specific times. And so those are the specific times, appointments, if you will, for the students to get their breakfast and lunch. Next slide. We are going to have a large number of other kinds of events. We have extracurricular activities. Those are going to continue. We have protocols to make them happen. We also have large events and large gatherings that are part of an academic community. We have commencement that we're trying to schedule in October, and other commencements if perhaps at the end of fall semester. We have rallies. We have speakers coming to campus. We have conferences and all sorts of meetings. For these, we have protocols. We ask the people who are organizing them to consider rescheduling if that would not harm the quality of our experience, or use a virtual mode if they can. But if they really have to have an in-person experience for the quality aspect, then they will develop health protocols. They will bring that to our public health and safety experts. We'll review it, and then our executive leadership will review the recommendations and make an approval. I'm now going to advance the slide and turn this over to our great athletic director, Dan Radakovich.
Thank you, Bob. Appreciate that a lot. We have been extremely busy here in the athletics area working on our return to campus and now return to competition. What we're looking at here is, as we move ahead, are our fall sports remaining on their traditional practice calendars. Looking forward to having those student athletes here and beginning their practice opportunities. Football August 5th, volleyball August 6th, women's soccer August 3rd, and men's soccer August the 10th. You may have read that the ACC has said there will be no competitions until at least September 1st. That is our circumstance right now. There will be more conversation moving forward on that in the coming weeks. The Board of Governors of the ACC will be looking no later than August the 5th for a decision. But I will tell you that given the scope of the pandemic, those can be fluid the entire fall. As we get into our minimum testing requirements, we created an ACC medical advisory group. And some of the reports back from that group were on testing timing for the sports that are in play. So you can see that they have recommended weekly testing for football, volleyball, soccer, and basketball, bi-weekly testing for baseball, softball, and rowing, and no testing requirements for golf, tennis, track and field, and cross country. Here at Clemson, we've been very forward on reporting our testing results. As of today, we've completed over 800 tests of both our student athletes and staff. And as we currently stand, we have no active positives and no student athletes in isolation. Our next scheduled fall sports testing is scheduled for the week of August 3rd for all of those sports that we had just mentioned previously that are coming back for their fall camp opportunities. Next slide, please. One of the things that's been very important for us is the communication with our season ticket holders and our IPTAY donors. We've tried to make sure that we have been extremely focused on customer service and planning. Back in February, for a very different reason, we created a sales and service team between IPTAY and our ticket office. But with the pandemic, they've been pressed into a little bit different duty. They are certainly a hub of activity, giving information to our to our season ticket holders and our IPTAY donors as that information arises. So that's been a very positive new part of our organization. Previously, we've announced refund plans for season ticket purchases for football, as well as refund opportunities for IPTAY donations. IPTAY donors have received that really within the last month. We've also talked about our mobile ticketing plans. Mobile ticketing is going to allow us great flexibility as we move forward into the fall, as it relates to the capacity of the stadium, which is still in flux. Many models have been pulled together on that, and hopefully in the next 3 weeks, we'll be able to move forward with some more specific detail associated with what capacity opportunities we will have for Memorial Stadium. The app that will allow mobile ticketing is being formulated now and will be released in August. A couple of weeks ago, we did a season ticket holder survey. We had an over 70% response rate from our IPTAY members and season ticket holders. And just 3 interesting items that came forward from that survey. 83% indicated they are comfortable coming to games this fall, obviously with social media distancing measures. 54% indicated they would prefer fall football without fans to spring football with fans. And 21% indicated they would tailgate on campus even if they did not have tickets. So a lot more on that survey. We will make sure that we get that out through some of the IPTAY communication options in the next few days. So Provost, back to you.
I am going to jump in at this point. I think we're coming down the home stretch, and we wanted to talk briefly about the financial impacts of COVID-19. I think we're all well aware that there's been a very significant impact on higher education and Clemson as a result of the pandemic. And so this chart below, it provides some current estimates, some current ranges of impacts for this fiscal year, 2021. You can see that top line, extraordinary expenses. A lot of this has to do with medical related expenses for testing. As you know, we are providing testing to all of our employees and students free of charge. There's many components of that. Personal protective equipment that we're providing, extraordinary cleaning expenses, just a whole host of things that are driving up our expenditures because of COVID. The second issue there is international enrollment. Usually a very stable enrollment for us. We're concerned about the situation of our international students and whether or not they'll be able to stay enrolled. So we're monitoring that very carefully. As we mentioned earlier, the auxiliary and other credits that I went through briefly, those are in the $12 to $15 million range. We are refining those numbers. Dan mentioned earlier the issues around stadium capacity. And so those athletic revenue range of 30 to 50 million is based on a variety of different scenarios with respect to stadium capacity and physical distancing. And then finally, research impacts. Our research labs have had, been impacted as well. And at some point, the research impacts can begin to mount as our researchers aren't allowed to do the research that they've been contracted to do, and then therefore reimbursements on that external funding will slow down. So all told, right now it's somewhere in the $70 to $135 million range. We are going to revisit all of these expense issues, and later this fall we will put in place an FY21 budget that will reflect the reality of where we're at with the disease once we know a little bit more about it. And that is, I believe, the last slide.
Tony, thank you very much. And to Provost Jones, Chip Hood, Dan and Tony, thank you for those very thorough presentations. Mr. President, it's so obvious the incredible amount of work that has gone into preparing ourselves for the COVID environment that we find ourselves in. And it's so very impressive. And I really appreciate the fact that we are a values-driven university. We're driven to make sure that we're making the best possible decisions that we can make that are in the best interest of our faculty, of our students, of our staff. And they're data-driven, they're science-driven, and I think that is serving us incredibly well. We'll be leaving public session in a few minutes, but before we do, I'd like to open it up, the floor up for questions and comments from members of the board.
Mike, this is Joe. I'd just like to ask the president, will the presentations that Chip and the provost and Dan made be put on Clemson's webpage so that students and parents and supporters can go in and look at those?
Joe, I don't know whether those full presentations will be put online. We can certainly take a look at that. We'll share as much of this information as we can and get it out as quickly as we can.
Well, this was all done in public session, and
yes,
so all the people that were able to join have seen it. And I just think when parents start trying to help work with their students to think through their safety, it'd be great to see what a great job you all have done, and all the considerations that you've taken into account as decisions were made.
Thank you, sir.
Great suggestion, Joe. Other comments, other questions?
This is Louis Land, Mr. Chairman. Back earlier, we talked about, Tony talked about the credits to the students, and it's not clear whether the credits are going to be issued. I think the previous credits were all issued as checks, and some of the mamas didn't know their kid had a check back. Can they have the option of leaving that credit on the books towards their next bill? I had several moms complain that Junior was partying because they didn't know they got the money back.
Louis, the process is really driven by financial aid and, our need to make sure that we don't do anything that would disrupt financial aid for students. So the full amount will be reflected on the bill. And there will be a credit that will stay in the student's account. Obviously, we're saying that publicly. And families will be able to, navigate it from there.
You're saying they don't have to take a check. They can leave it for the next semester.
It will be a credit. So the total fee that they will pay will be less that credit.
Okay. Gotcha. Thank you.
Other questions, other comments? Okay. We're blessed today to be joined by virtually by some of our faculty leaders. And to you, Provost Jones, and to the faculty leaders that are with us today, please convey to our greater faculty body a special thank you from Clemson's Board of Trustees for everything that you have done and that you're continuing to do today. I think we are in an outstanding place thanks to you, thanks to your heavy lifting. It started when the pandemic first hit. And it continues through today, and we appreciate you very much, and just wanted to say that to you. Also, the board joins the president and the leadership in saying that we are laser focused in wanting to get our students back to campus as soon as possible. That said, though, the health and safety of our students, our faculty, and our staff are of primary importance. So I want to encourage everyone associated with Clemson to do their part in helping us get back to campus as quickly as possible. We now need to go into executive session to receive legal advice regarding liabilities and claims, including those arising from the COVID-19 pandemic and other matters covered by the attorney-client privilege, to discuss pending contractual matters and to discuss personnel matters, including the annual review of the president. No votes or action will be taken. We do not expect to reconvene in public session. I ask that only the trustees, trustee emeriti, board secretary, and staff, president, members of the ELT, and our internal auditor stay in the meeting. And Sally, if you will, please confirm to us that our guests have exited the meeting. It is 9:45. I would suggest that we take a 10-minute break and reconvene at 9:55. To all our guests who have been here, thank you for being here. Have a great day. And to the rest, we'll see you in a few minutes. Thank you.